Hello friends, in today's video we will gonna learn about respiratory acidosis. So let's get started. In respiratory acidosis, carbon dioxide will be high, which is greater than 45, and pH will be low, which is less than 7.35. What happened in respiratory acidosis? Patient is taking shallow breath. Patient is not able to take a deep breath. Because of the shallow breath, there is accumulation of carbon dioxide in the lungs, and pH will be low. That will lead to respiratory acidosis. Patient's respiratory rate is low and patient will be hypoventilating. When patients hypoventilate, the lungs are retaining too much CO2. So now how the kidney will compensate? So we learned in the previous video that opposite organ will always compensate. If there is an issue with the lungs, the kidney will compensate. And if there is any issue with the kidney, the lungs will compensate. So in respiratory acidosis, the kidney will excrete the excess hydrogen ion in the urine. So hydrogen ion is the acid and that the kidney will excrete in the urine and retain the bicarbonate which is base in order to maintain acid base balance. So what happened in respiratory acidosis? There is too much carbon dioxide retaining into the patient's lungs. Carbon dioxide is the acid. So in order to compensate, the kidney will excrete the hydrogen ion in the urine, that is acid, in order to maintain the acid base balance and also retain the bicarbonate which is base. Now, what condition that cause respiratory acidosis? So first we have a drugs such as opioids and sedative. This is big for the nurses. Whenever we give opioid or sedative, we always check patient's vital sign before and after. For the adult, if respiratory rate is less than 12, we don't administer this medication because that will suppress the respiratory system. Proper interval between the drugs is also very important for opioid and sedatives. Any airway obstruction such as sleep apnea when patient is not taking deep breath and shallow breath that will lead to accumulation of carbon dioxide. Alcoholism, post-operative patient, especially if the patient has a surgery over the chest or abdomen because of the pain patient will not going to take a deep breath. Also, in postoperative period, patients are under the effect of general anesthesia. The shallow breathing will lead to retaining of carbon dioxide. Any injury to the chest, if the patient is having stroke. Also, the disease condition in which there is impaired gas exchange. Disease such as asthma, COPD, pulmonary edema, and pneumonia. There are chances that patient will develop respiratory acidosis. Now, what sign and symptoms you will see in the patient? Patient will be hypoventilating, right? The hypoventilation is also one of the cause of respiratory acidosis. Shallow breathing, the respiratory rate will be less than 12 for adults. All other symptoms you will see headache, confusion, restlessness, and decreased LOC, which is level of consciousness. When the brain is not getting enough oxygen, there is so much carbon dioxide in the blood, less oxygen. So vital organ and the brain is not getting enough oxygen. In results to that, patient will have headache, confusion, patient will be restless, and there will be chances that patient will go in coma or patient will be unconscious. Now, what intervention we will gonna do for this patient? So administer oxygen, check the oxygen saturation and administer it if it's low. Give a proper position to the patient. Give them high Fowler position, or if this is a post-operative patient, maybe give them a proper position that they are able to take a deep breath. Encourage coughing and deep breathing to the patient. Suction the patient PRN if needed. If the patient has accumulation of saliva or any secretion, suction them followed by the mouth care that will increase the gas exchange. Some patients might need ventilator. Administer medication. So medication is based on what is the cause. If the patient has pneumonia, administer antibiotics. If the patient has pulmonary edema, then administer diuretics because that fluid is not allowing the lungs to expand. If the patient has any inflammatory condition going on, then give corticosteroid and bronchodilator that will help the patient. Also, monitor the potassium level. There will be some potassium changes into when the acid base imbalance. So, monitor patient potassium level. What will happen to the potassium with acidosis? So during acidosis, the hydrogen ion, there is too much acid in the blood, which is H plus. In order to compensate what the body will do, the hydrogen ion will go inside the cell. And in order to make a space inside the cell for the hydrogen ion, potassium ion will go into the bloodstream that will lead to hyperkalemia. So very important when the patient has respiratory acidosis, monitor the potassium level because anything with high or low potassium patient is at risk of cardiac arrhythmia. Thank you for watching. I hope this video will help you to understand respiratory acidosis.